I can easily say when the patient is walking in, I can tell this is a robotic patient.
I think you have repaired enough bones to build a skeleton army.
We are like carpenters. Everybody is down.
Yeah.
With the phone down, nobody is looking up nowadays.
So welcome to the program, doctor, and it's a pleasure to have you always.
Thank you very much.
So orthopedic surgeon, do you think it's fascinating because some days you get to be a doctor and some engineer and partly also a pilot navigating the robotic system?
Frankly speaking, my interest was to do engineering. So that's why I chose this field wherein there is a combination of both medicine as well as engineering. And like you rightly said, yes, now the robotics. Robotics has changed the field completely because you get to plan much ahead. So it's really fun. That's why I never get tired, even though I work 14 hours a day. At the end of the day, if I'm doing more, I get more encouraged and get more energetic because this is what you like.
I remember you telling me that you love gadgets and playing with gadgets last time I had a conversation with you.
Yeah, absolutely. Even saying that today, I got one more company guy just coming around and said, by the way, do you know we have got a latest software, like latest gadget that we can make it things much more better. Now, as you walk in with the goggles, you can get the patient's anatomy on top of the body, and it's much easier for you to relate both, like as if you're operating, and also doing the 3D picture. Imagine I'm operating on a bone. I get the 3D picture of the bone and how the fracture is and how to plan it. So this is something nice. Look, it's more like yes, like you rightly said, gadgets, and we are like kids.
So doctor, I think you have repaired enough bones to build a skeleton army. So when you look back, how does your journey seem to you? How does it look like to you?
Frankly, I'm really happy that I chose this field. The reason being, when I got through my entrance tests and all, I chose to become an orthopedic surgeon. Even though I got one of the best ranks, I was offered all the varieties because this is what I want to do. Like, a bit of engineering, you're trying to build up something. And I think so far I've operated about 70,000 knees, and I would say everything together, put together, 17,000 operations in the last 27 years.
That's a big number.
Yes, it is. But each and everything is like, a learning thing for you. You get to take home something. Like, even going home, sometimes you think, oh, well, I should have done this way. On table, the stress is different. So most of the time, on-table management is more important. So you have to keep yourself cool most of the time, and also the judgment, immediate judgment at the time. These are the things that slowly over time you mature, and also from your previous experiences, you try to learn things. So definitely, I would say I'm a better person from what I was 27 years ago. So yes, it is fun.
So as an orthopedic surgeon, doctor, what's the most underrated joint according to you?
I wouldn't say underrated. The reason being, each joint has its own role, and sometimes we don't really relate and we don't really realize the importance. Like recently we've done a nice interesting surgery around the elbow. When you see from the patient's perspective, that's when you realize, when you can't move that particular elbow or whatever, that's when you realize how handicapped you are.
So we all say that movement is medicine, but sometimes movement can be a challenging thing to do, especially, and then they come to you, right?
Yes.
So what are some common reasons that people come to you because of some elbow issues?
Well, the commonest what we see nowadays, we heard of tennis elbow. That's the most commonest. Then other side of the elbow, we have what's called golfer's elbow, the pain on the inside of the elbow. So these are the most commonest things that we see. And then injuries around the elbow and not being managed properly. Like, elbow, like you said, movement is medicine. We want to get the joints moving as soon as possible. And usually we tend to take it off within 3 weeks. There are people who were asked not to move it for 6 weeks and it is stuck. That's when you realize to get it out of that, the amount of hard work you have to do, including physiotherapy, very difficult.
So do you necessarily have to play tennis or golf to get these?
That's a good one. Yes, that was seen probably commonly more in tennis playing people. But I see lots of those problems now in housewives who keep coming to me And I don't think they play tennis. They ever played tennis also in their life.
I
Need
know
not be.
Sachin Tendulkar suffering with tennis elbow, though he plays cricket.
Yeah, true. I mean, it's the movement that he does, so that's what he gets.
So when we talk about joint replacement, the only joints we think of are knees first and probably a hip, And but elbow joint replacement is something I haven't heard of.
This elbow replacement I learned when I was in London. I worked there for 10 years, so that's where I learned. And when I came back to India in 2013, that's when I did the first one in twin Telugu states. The reason why we have to have elbow replacement is to get the mobility, like you rightly said. If you imagine yourself being stuck down, so I keep telling people also to wrap a cloth around, make sure your elbow doesn't move. That's when you realize you can't eat, you have to bend forward, still you can't reach food, and you can't do your daily chores. At the most, your shoulder is compensating to some extent, but without that movement. And also, your rotations are stuck. So, your day-to-day chores are gone.
So no doubt, elbow feels a little out of the place when you talk about replacement.
True.
When someone says knee replacement, we all can imagine how a knee looks like or a hip looks like. Kani elbow replacement anangane, I mean, it's so complex to even think how it looks like. Don't you think it's a complex joint?
So it was initially difficult to get your brains down. Because like you rightly said, you're not used to that joint commonly. And also it has 3 bones. Which are articulating, whereas the knee, it's mainly the 2 bones that articulate. So these 3 bones, you have to match them. Even if you don't match either of them, then the joint stability is at stake. So that's what you have to take care. And it's also, we call it hinge joint. So we have to maintain the range of movements. But as you're doing the numbers, you get used to that. And now that I've done good numbers, so I got used to now. So I don't have to worry much.
And also I read somewhere, that you were the first person to do this elbow replacement surgery way back in 2014. Am I right?
I think that I was the first one to do in twin Telugu states. The reason I came to know about that was because when this patient came, I wanted to do that, but I couldn't find a company. It's usually the implants are provided by the company. I was trying to ask around. They said, no, we have never provided in Andhra and Telangana. I said, that's when I came to learn that nobody has done so far. But since then, since the past 12 years, we've done good numbers and the results are really good.
So tell me, how do you keep yourself so strong and fit? I mean, what's the secret being an orthopedic surgeon? Please spill the tea.
Yeah, that's a good one because orthopedics itself is a hard work. Like, we are like carpenters. Yeah. So we are being carpenters.
Cemetery
inside.
Job.
Yes, we are doing the hard work inside the theatres. I mean, it involves standing up for longer hours. The longest operation I've done was for 9 hours at a stretch without a break. So there are some instances like that, and there are also some instances I have to lift up the leg of that heavy patient.
Yeah, we see those videos on the Instagram, especially. Orthopedic surgeon, they take the hammer and keep hitting it.
Yes, you've seen one where the nail has come out, but the amount of hard work he has to do, literally.
Is that a real one?
It is. See, because the nail is stuck in the bone, you have to take it out. So you have to hammer it so hard. So it has to come out. So you are using all your force. So this is like you're doing your workups every day in the theatre.
So you don't have to go to the gym every day.
You don't have to, yeah.
So tell me the first time, you've ever performed a surgery all by yourself. How was that experience?
Very scary and very confusing. Because, when somebody is around, you're all organized. This was, my first experience was in Birmingham. I still remember that day. And everything set, they said, okay, Sunil, you're going to go and operate there. Went inside. Then I was trying to look around, is everything in place? Asking the nurses and having doubts at each and every step, you won't believe. How should I have organized? How should the patient position be? Where should I? So ever since, you won't believe, each and every operation which is important, I write down. Whatever I do new, I write down because I can replicate the same thing. Because the operation, I can say, is like an art. You don't want to mess it up like, a butcher shop. Anybody can do surgery for that matter. But it should look like a beautiful art and the end result should be beautiful. And the patient should be benefited.
So talking about technique and latest technologies, robotics, we hear this word everywhere. So how is robotics changed the field of orthopedics?
I would say fantastic and very promising both for the doctor and the patient. But now adding on the robotics, what I have seen, like last 2 years I've done around about 2,300 knee replacements. Just the knee replacements, out of which I've done about 1,000 robotics and 1,300 conventional, that is non-robotic. And it's almost like equal numbers, 1,000 and 1,300. So if you see there, I can easily say when the patient is walking in, I can tell this is a robotic patient.
Oh, really?
Yes, absolutely. Because see, I get the file before and it only says 6 weeks post-op or 2 weeks post-op. Majority of my robotics, 2 weeks, they don't even hold anything. They just walk in.
And that's such a big difference.
And once you'll be surprised to know, person who walked in her regular dress, I was looking at, where's the patient? She was smiling. It's only 2 weeks in her knee replacement. She was so happy. Sometimes beautiful things like that, you feel very happy. It's probably one in a lot of patients, but at least one patient who is really happy at 2 weeks, just had her own dress, came for suture removal all alone without any aids. So I see robotics as a future, mainly in areas of putting the implant in the perfect position that translates into better longevity. So the longevity of the implant goes further ahead, so the chance of resurgery is much less. Patient pain, definitely I would say 40 to 50% less compared to the conventional. Then the amount of physiotherapy pain, much less. And the knee bending, because we plan much ahead. Even before surgery, we plan how much and all, range of movements, the stability.
I think end of the day, the patient should be happy and more comfortable than what they were before surgery, and that matters.
Absolutely, true. And there's one nice thing called forget hip. That is like, after a year of hip replacement, people forget that they had a joint replacement.
Oh, that's an interesting word I haven't heard of. So is there any role of robotics for elbow replacements as well, doctor?
There can be, because see, at the end of the day, whatever we do, we want to put the implants in the best possible position in precision. So currently we have robotics for knee replacement, hip replacement and shoulder. And also now the new generation robots we are using for trauma as well. And I'm hoping in the future we are getting for elbow as well.
So what are some, good habits that you have inculcated in your lifestyle that you follow religiously?
Oh, difficult. You can say bad habits, not good habits. Because people always say that doctors are bad patients.
Or healthy habits.
Yeah, I would. Frankly, yes. At one point, because of the stress, I had put on weight, and again, I thought, no, I should be an example to somebody. So sometimes these cortisol levels, they all add up, late night sleep, late night dinners, and you can't help it because of the workload. Coming to the discipline, yes, I get up early and try to do a bit of physical activity. At the end of the day, even though I do a lot of hard work in the theatre, majority of my job is sitting down consulting. So my sitting activity is more than my other activities. So I would rather do a bit of physical activity before I come to the hospital. And also dietary changes. Yes, definitely you want to be calorie conscious and not to pile on too much of weight.
So before we wrap this episode, doctor, someone watching this episode is struggling with chronic joint pains. So what would you like to tell them? The
first and foremost I would inform them is, don't wait more than 5 days. If a joint is troubling you, don't take it easy. Even if you've tripped and slipped and twisted your ankle, that's the commonest thing people ignore. So you've done some injury, that's why it's hurting. So address that. So first is at home, give it some time, rest, ice packs, elevation, all this, we call it RICE. And also if it's not settling, I would suggest first approach a doctor that you like. But at the end of the day, my message to everybody is, if you don't trust somebody or don't trust a doctor, go to somebody else. Take a correct opinion. That's the most important thing.
Internet is overloaded with information.
Exactly. Yeah.
So the right information coming from right people like you makes a difference.
Absolutely. And I see a lot of my patients in them. You know the reason? Everybody's down.
Yeah.
With the phone down, nobody's looking up nowadays. So they'll come to me with back pain and neck pains now.
So I think healthy joint means freedom of movement, and freedom of movement means a healthy living.
Absolutely. Agree with you.
So thank you, Dr. Sunil. It was wonderful having a chat with you. Thank you so much.
Thank you very much, ma'am.